Hello everyone and welcome to this audio podcast. This audio podcast is part of a Storm Collective. This audio podcast is part of a Storm Expose. This audio podcast is part of a Storm and Ostix Indicate. This audio podcast is part of the Journal, and this audio podcast is part of a Storm Logistics production. In this audio podcast, today looking at the research gap and approach and research question, strengths and limitations, as part of a publication, a sort of a literature review, a publication by Mohammed and team from 2016, looking at can social media reduce discrimination and ignorance towards patients with long-term conditions, and looking at a chronic kidney disease or CKD example in the United Kingdom, and more widely, a publication in as part of this publication. The publication looks to investigate how social media as an example of assistive technology is utilized in an increasingly sort of digital age, and how assistive technology might help raise awareness, or social media might help raise awareness to preclude ignorance and discrimination in those who suffer with long-term conditions and disabilities. And as part of the research question, the focus the focus of the publication was to understand if discrimination and ignorance surrounding two populations, or where the publication looks at those with long-standing or long-term conditions, and in around those with disabilities, the two populations, and looking at a perspective from two kidney or renal global social media platforms that have been bridging racial disparities and healthcare inequalities. The publication is aligned to patient and public involvement. The one sort of the in around the strength of the publication. One of the sort of main strengths of the publication was that if it had is that the authors and co-authors had represented organizations that had been involved to bring more awareness and equality, representing young people and those with disabilities and those with long-term conditions. And at the same time, as the publication, in around this publication, there was little or no research that looked at two cohorts of ailments, i.e., again, disabilities, those with disabilities, and those with long-term conditions. And around the limitations of this publication was the design. The design of the publication should have included a sort of case study. That draws this audio podcast to a close. This audio podcast as part of a Storm Collective. This audio podcast as part of a Storm Expose. This audio podcast as part of the Journal, and this audio podcast as part of a Storm and Ostix Indica, and this audio podcast as part of a Storm Logistics production.